A new study from the American Lung Association finds California has the worst lung cancer screening rate, with only 1% of those at risk coming in for them.
It really breaks my heart because lung cancer remains the #1 cause of cancer-related death.
Dr. Tom Buchholz is the medical director at Scripps Health's MD Anderson Cancer Center. He says lung cancer is typically diagnosed at later stages when the survival rate is low, but those diagnosed and treated early have much better outcomes.
So we have to have a greater concerted effort to get those patients in need of screening to the appropriate screening studies.
Buchholz says Scripps officials have worked to streamline the screening process to make it easier for those at risk. Doctors say anyone over 50 who smoked a pack of cigarettes a day for 20 years should be getting screened. Typically, referrals come from primary care doctors.
That doctor who knows the patient, who says, you've been smoking for 30 years, you need to get a lung cancer screening.
Dr. Charles Redfern is medical director of the Laurel Cancer Institute at Sharp Memorial Hospital.
Because a lot of people think you can't do much for lung cancer. Well, you can do a lot if you find it early. That's really the message here.
Redfern says lung cancer screenings are done through CT scans. He says over the last decade, more insurance plans and Medicare have moved to cover them.
You don't get injected with anything. You don't get an IV put in. You lie in a CT scanner. You basically hold your breath and go through the machine. The actual test takes like a minute.
While the use of cigarettes has gone down in the U.S., cannabis and nicotine vaping products are on the rise. Officials say more lung cancer research is needed there.
It's hard for me to imagine inhaling a electronic heated inhaled nicotine product with flavored chemicals in it is good for your lung.
Redfern says regular lung cancer screenings can actually help people quit smoking too. Those at risk are encouraged to reach out to their providers and schedule a screening. Matt Hoffman, KPBS News.